syringe. Can you see the difference in the size?
Yeah, the other one's
Because I can't order more because we don't have a dentist on hand. But if you notice, your rubber stopper is at the end of this one and it's full of fluid. Got it? Okay. Are you recording?
Yeah.
Oh, awesome. Okay. So then this is your rubber stopper. This is your metal cap. You should come in, you should clean it with the alcohol. You should assemble the, I'm trying to think how we do it. So you're gonna tell me this is your thumb ring, this is the piston, this is the barrel, and the harpoon. You must engage your harpoon into the rubber stopper in order to move the solution and be able to aspirate the syringe in. So, this is going to tell you anesthetic, like lidocaine, and it tells you that it has epinephrine in it. I'll go back about the epinephrine in it. Would we use it with a heart patient? Somebody who has high blood pressure? No, because it constricts the blood vessels more? Okay, so you're going to take your cartridge or your syringe, you're gonna pull it back. So they show you doing it with your finger, and at HOSA, to me, that's very hard, especially if you have small hands. Otherwise, you put it, this is how I do it, I put it in my palm of my hand and I retract it. You're going to place your rubber stopper on that end and your needle in. Remember, this is an aluminum cap that should go towards the needle. Then you are going to take, if you are doing a block, is it gonna be long or short? Very good. Yellow is long. You're gonna take the cap end off and you're gonna screw it on. One thing I forgot to tell you is make sure all of your syringe is in place when you take it out of the pouch. Because if this is loose and you hand it to the dentist, that's not good. You engage the harpoon, so you tap it, and your rubber stopper should be here, and then you would expel a couple drops. So you're gonna take this off, you're gonna put it in your engineered recapping device, these are both. You would expel a couple drops just to make sure it's engaged, but we're not gonna be able to because there's no solution left. Then you are going to recap, you're gonna be very gentle, and you're gonna disassemble it. Prior to giving local anesthetic, you are going to wipe the tissue and you are going to place the topical anesthetic using the cotton tip applicator on the tissue where the injection is going to be for 1 minute. Okay, so without me talking all the way through it, I'm going to disassemble and I'm going to if it doesn't have epinephrine, this will be different colors too. So this will tell you like what the material is in it. This is lidocaine 2%. It should have expiration date on it. If there was bubbles in it or if it's cracked, should we use it? No. Okay, here we go. So I'm going to retract the barrel or the piston. I'm going to put a infiltration short needle on, and I am going to engage my harpoon. Here you are. This is aspirating syringe. I want you guys to say aspirating because you need to aspirate before you inject. That's it, guys. Another lab.